Hi, my name is Martia Mathis, and I am a public health studies online major. The topic that I will be covering in this presentation is cerebral palsy. So, let's start with the basics. What is cerebral palsy? Cerebral palsy is an umbrella term used to define a neurological disorder or a group of neurological disorders resulting in damage to motor skills. Cerebral palsy typically occurs before, during, or immediately after birth. It can sometimes take up to a year to 2 years to diagnose cerebral palsy. Cerebral palsy is broken down into four types based on what the brain lesion affects: spastic, dikinetic, ataxic, and mixed. Spastic is the most common type of cerebral palsy as it affects over 70% of cerebral palsy cases. Spastic cerebral palsy is characterized by increased muscle tone or contraction. You will notice stiff and jerky movements in someone with this type of cerebral palsy. Studies around the prevalence of cerebral palsy vary. They have shown from 2 to 4 out of every 1,000 people in the United States has cerebral palsy. Furthermore, the prevalence rate is 10 times higher in premature babies and babies with low birth weight. 8,000 to 10,000 babies born each year develop cerebral palsy, making it the #1 lead cause of childhood disability that affects development and function. Cerebral palsy is often idiopathic. Cerebral palsy is usually the result of brain injury or brain malformation that occurs before, during, or immediately after birth while the infant's brain is still developing. Prenatal infections are infections passed from the mother to the baby. Prenatal infections are most dangerous in the first couple of weeks following conception. Rubella is an example of a prenatal infection that can lead to cerebral palsy. Also, infections after birth can cause brain damage and lead to CP. Other risk factors of CP include multiple births, birth complications, and medical conditions of the mother. There is no test that can diagnose or rule out cerebral palsy for certain. It is usually diagnosed based on clinical observation. Maturity at birth is one of the major predictors of cerebral palsy. Doctors may use lab testing and imaging such as CT scans and MRIs of the brain to rule out other diseases and disorders. The diagnosis can only be made after abnormalities of motor development are recognized. There is no cure for cerebral palsy. However, the effects of the condition can be managed. Treatment depends on the type of cerebral palsy and how the person is affected by it. People who suffer from CP will usually attend occupational, physical, or speech therapy, or a combination of the three, depending on which of their motor skills are impaired. The earlier on the therapy is started, the better it will be for the child. They may wear casts or braces to assist with walking or to improve their posture. They may also take medications such as muscle relaxers to help with spasms. In some cases, surgery is required. In addition to all of that, it is important that children suffering with cerebral palsy have doctor's office visits regularly to ensure that they are reaching their full potential in all aspects of their life, not just physically. On this slide, I have listed the websites of 3 of the many nonprofit organizations designed to support children with cerebral palsy and their families. One of them is located right here in Greensboro. Greensboro's Cerebral Palsy Association works with children from birth up until age of 3 in order to help them with their development. All of these organizations are contributing to research and the well-being of those who live with cerebral palsy. That concludes my presentation. On this slide, I have cited all of the resources that I used throughout my research. I hope you have found this to be educational, and thank you for watching.